Hi, everyone. I'm Elaine Quijano. On Monday, the White House was basking in headlines about the summary of Special Counsel Robert Mueller's report. But now the administration is back in a familiar position, playing defense. The administration is under fire for a budget proposal that cut funding for the Special Olympics. And Education Secretary Betsy DeVos, whose department oversees that funding, faced bipartisan criticism when she appeared before Congress this week. President Trump publicly walked back that proposal, telling reporters, quote, "I've overridden my people. We're funding the Special Olympics." And earlier this week, President Trump's Justice Department announced a new offensive against the Affordable Care Act, catching even Republicans off guard. In her latest piece, our Caitlin Huey-Burns writes, Republicans were left scratching their heads, wondering why the president would bring up a sore subject when he had better news to tout. We'll speak with Caitlin in a moment. Meanwhile, Democrats are getting ready for a fight. Here's what House Speaker Nancy Pelosi said.
We are focused on meeting the needs of the American people in their lives, and that is not what the administration is doing. And you would think the Justice Department would be busy vetting the report so it could more quickly bring it to the public in public view. Instead, what do? They're going to court to overturn every single provision of the Affordable Care Act. Not a good use of their time. We'll see them in court.
Let's bring in Caitlin Huey-Burns and Sean Sullivan. Caitlin is a CBSN political reporter, and Sean is a national political reporter for The Washington Post. Thanks to you both for being here. Caitlin, let me start with you on this walk back from the president on this Special Olympics budget proposal to cut the funding. Here's what he told reporters about this before leaving for his rally in Michigan.
Special Olympics will be funded. I just told my people I want to fund the Special Olympics, and I just authorized a funding of the Special Olympics. I've been to the Special Olympics. I think it's incredible, and I just authorized a funding. I heard about it this morning. I have overridden my people. We're funding the Special Olympics.
I mean, Caitlin, so interesting to hear the president say that he just heard about it this morning and he's overridden his people.
And it's the president's own budget, which is important to point out. And here he is responding to the public pressure kind of off the fly. And it raises questions that we've seen throughout his administration about who speaks for the administration. It is Donald Trump. And so we have seen at times him undercut his own staff, his own members of the cabinet. And that was clearly on display today. But members, Democrats on the various committees and the public were really putting the pressure on.
So, Caitlin, let's get back to your reporting about the reaction to the president's pivot that caught people, and especially Republicans, off guard. They were not expecting the president to start talking about health care. What happened there?
Not at all. I mean, the president was coming off of what he and his allies saw as very good news, coming off the conclusion of the Mueller report and Attorney General Bill Barr's presentation or outline of that report that showed, at least in Barr's telling, no collusion. They thought the president could have a couple of good days of news over this and then pivot to issues that they would like to talk about, which are related to the economy especially. Instead, the president started talking about health care. And a lot of Republicans were saying, wait a second, we just lost 40 seats in 2018 because Democrats campaigned effectively and won on the issue of health care. And that was in large part because of the response to the Republican efforts the previous year to repeal the Affordable Care Act, which we've seen, at least in polling, has some very popular measures, protections for pre-existing conditions among them. So Democratic strategists I have talked to have said flat out, this is not a winning issue for us. This is not something we want to address. And the president just kind of moved ahead and tried to do it anyway, seeing an opportunity, he thinks, to go on the offensive on an issue that he knows is vulnerable.
So, Sean, when Republicans controlled both chambers of Congress, they were unable to agree on an alternative to the Affordable Care Act. What are you hearing now about the potential of trying to craft one now in a divided government?
Well, if they thought it was hard back then, it's going to be near impossible now. And Republicans have realized this for months. All you have to do is go back to the day after the midterm elections. Look at what Mitch McConnell, the Senate Majority Leader, said. Look at what other Republican strategists said. They effectively waved the white flag when it comes to trying to repeal and replace Obamacare. They knew that they didn't have the agreement within their own ranks to get it done, and that they saw that Democrats were about to take control of the House. So in terms of overhauling the federal health care law, starting from scratch, coming up with something different. This is not something politically that Republicans have had any appetite, at least Republicans on Capitol Hill, have had any appetite to tackle over the past few months. They've been happy to have a debate with Democrats on health care, but what they want to contrast is the debate that's going on within the Democratic Party over Medicare for all, over universal health coverage. They want to point to that and say, look, Democrats are the ones trying to upend the system. But now when you have the president and his administration introducing a new wrench into the plans, it makes it harder for Republicans to do that. So it's a politically challenging thing that they have to deal with right now.
Well, we know that healthcare is such an important issue to a lot of voters. And Caitlin, CBS News exit polling from the 2018 midterms found healthcare to be the top issue for voters. Democrats use that to pick up 40 seats in the House. I mean, how much do they feel a new focus on this issue is a political gift for them here moving towards 2020?
Absolutely. I don't think they could have scripted it better themselves. They were already planning to kind of pivot to turn to issues, especially now that they're at the start of a really competitive Democratic primary, as Sean just mentioned. I can tell you from being out on the road that healthcare still comes up as the top concern among voters that I talk to. And what Democrats are talking about in their embrace, really, for a universal healthcare plan, many of them supporting a Medicare for all type system, is they believe it's a value statement to those voters saying, look, we don't want to take away your healthcare, we actually want to expand it. Now, of course, that opens up opportunities for Republicans to go after, as Sean just laid out there. But with this move by the president and with Democrats saying, well, what is your plan? They are able to kind of have it all different sorts of ways, push themselves as the party of healthcare and also ask Republicans what their plan is. We know that Republicans are very good at running against the Affordable Care Act or running against Obamacare and some of those provisions. But when it comes to actually putting forth their own proposals, they haven't yet convinced the public and they haven't yet been able to coalesce around an actual idea. So this puts them off a winning position and onto a more defensive one.
So, Sean, with healthcare being a core issue or becoming a core issue for some 2020 candidates, what is it specifically that you are hearing from them about this? Because as Caitlin just outlined, there's such a range of possibilities here.
There really are such a range of possibilities. And right now, you really have two sort of parallel debates happening. You have the debate in the Democratic Party between some of the candidates and between, members of Congress and other members of Congress about what the future of healthcare should be. Should it be a Medicare for all system that abolishes private insurance? Should it be a system that expands Medicare but still preserves some private insurance? And to Caitlin's point, that is the debate that Republicans wanted to point at and say, look at what's happening on the other side. But then you have this other debate, which is the debate between Democrats and Republicans. And Democratic strategists I've talked to say, look, if we can frame the debate this way, if we can say one party, and that's the Republican Party, wants to take away your health care, and the other party, the Democratic Party, wants to preserve your health care, they believe that is a winning formula ultimately for them. They look at 2018, they look at the House seats that they were able to pick up in some of these swing areas and some of these suburban districts, and they believe, the Democrats do, that if that is a contrast that is top of mind for voters in 2020, that is a winning issue for Democrats in some of these swing states like Pennsylvania, Michigan, Ohio, some of the places where we're going to see some really intense campaigning next year.
So, I mean, Caitlin, given what Sean just spelled out there and how Democrats really feel this is an opportunity for them, why is it that the White House is choosing to focus on health care now, especially following what the president himself has called a quote-unquote total exoneration when it comes to the Attorney General's summary, at least, of the Mueller report?
Yeah, well, the president knows that he is heading into a re-election where health care is going to still remain a top issue for people. He does seem to realize that it's a vulnerability for Republicans, at least as it related to the 2018 elections. There is a difference, though, however, about talking about what Democrats are doing about health care and coming up with a plan on your own. So the president seems to have moved ahead of Republican lawmakers who weren't ready with any kind of proposal that they could put forward as the president made this important shift. We have seen Republicans talk about the high costs of health care. You've seen them talk with Democrats about the rise in prescription drug prices. That's a bipartisan issue, but we haven't seen any movement yet on the actual policy. And it remains to be seen whether and how these two parties can work together when a lot of them think, let's litigate who should be in charge at the ballot box in 2020 and then go from there. So it's a politically fraught issue. It's a it's an issue that really fundamentally fundamentally affects people. And that's why you see such a visceral reaction to it in politics. Any kind of change you try to introduce when it comes to healthcare policy really, upsets voters and kind of freaks them out a little bit. And the party in power is often the one that is blamed.
It's interesting, though, because prescription drug prices, we know, I mean, this is an issue, it's a perfect example of an issue that affects millions of everyday Americans, and yet, as you said, there's been no policy change on it. Sean, let me turn to you. Earlier this week, you wrote about how 2020 Democratic presidential hopefuls were trying to frame the end of the Mueller investigation as a win. This is fascinating to me. What are their arguments here?
Well, a lot of Democrats I talked to, both the ones who are affiliated with these campaigns and also just activists who are sort of looking at the field right now, deciding who to support, are saying that what they want from these Democratic candidates is more than just an argument against President Trump. It's more than just a criticism of President Trump. They want to hear these Democrats articulate why they think they should be president, what their policy ideas are, what their ideological positions are, and what their visions are for the future of the country. And, when you looked before we saw this summary of the Mueller report released, there was certainly this possibility. Would the president be under this legal cloud? Would he face a lot of criticism based on the findings of this report? Would there be conclusive evidence about collusion? And now that the summary of the report is out, Democrats are saying, look, here is a chance for us to talk about the issues that we think are going to be able to move the needle with these swing voters. And healthcare is one of those issues they believe these candidates should be talking about. So Democrats look at the situation right now, and a couple of things stick out to them. One thing that I'm hearing is that electability really, really matters now. You look at some of these polls, certainly the president's standing is not good across the board, but Democrats are starting to realize it's not going to take just anyone to defeat this president. They need a candidate who can go out there, make the case to the American people, to independent voters, that the time for a change is necessary and it's now. And they're going to need a candidate, they realize, that is going to be electable enough to do that, and they can't just put anybody up. So they believe that if they can talk about some of the issues that they think can actually move not only Democratic voters, but independents and maybe some Republicans, this could be something that could play to their advantage, or at least it would focus the race on the things that a lot of Democrats feel the need to talk about right now.
And Sean, your Washington Post colleague Bob Costa writes this today about House Speaker Nancy Pelosi, quote, from reassuring and reining in Democrats furious with Attorney General William P. Barr to rallying her colleagues to fight the Trump administration's efforts to gut President Barack Obama's health care law, Pelosi has taken charge. And as the large Democratic presidential primary field still takes shape and lacks a frontrunner to serve as its pace setter, Pelosi has stepped in to do just that. How are you seeing this play out on the Hill, Sean?
Well, it's a difficult balancing act right now for Pelosi because on the one hand, you have some Democrats in the party who are not ready to put the Mueller report behind them. They want to see the actual report, and they want to keep talking about this, and they want to keep drilling down on this, and they want to keep raising the questions that they have been raising about President Trump's conduct, about the conduct of his aides. On the other hand, you have Democrats who look at the situation now and say, look, it is time to move on. We need to sort of look at some of these bigger picture issues that we've been talking about, healthcare and some other issues. And so Pelosi has to kind of balance those two competing camps, and it's not an easy job. We've already seen so far this year Democrats fight with each other, argue, disagree with each other on a range of subjects. And so right now what she has to do is sort of balance the needs of both of those camps, which again is not easy. But I think what we're seeing from Pelosi, her overarching message this week is that she's siding more with the wing of the party that says, let's move on, let's move forward, let's talk about health care, let's not get stuck relitigating old topics that we should move on from. And so we'll see if that's a tenable position politically for her, or whether she feels pressure from the left, particularly, not to back down from going after Trump, investigating Trump, and getting to the bottom of the Mueller report.
All right, Sean Sullivan and Caitlin Huey-Burns, thank you.